Lyme disease, co-infections, and mold exposure. For people dealing with chronic Lyme disease and co-infections such as Bartonella or Babesia, recovery can be complicated. One issue that is sometimes overlooked is the possible added burden of mold exposure and mycotoxins in the indoor environment. Mold exposure does not mean it is the only cause of symptoms. But for some people, it may be an additional stressor that makes an already difficult situation harder to manage. Lyme disease, co-infections, and mold-related illness can involve overlapping symptoms. These may include fatigue, brain fog, joint pain, headaches, neurological complaints, sleep problems, and general sensitivity to the indoor environment. Because the symptoms can overlap, it can be difficult to know what is coming from infection, what may be related to the building, and what may be caused by other health factors. That is why the indoor environment should be evaluated carefully, not emotionally. Mold and damp building conditions may contribute to a higher overall burden on the body. For some sensitive individuals, ongoing exposure to mold, water-damaged materials, or poor indoor air quality may make it harder to feel stable while they are also working through chronic health issues. The key point is this: if someone is working hard on their health but continues to live or work in a damp or mold-impacted building, the environment may need to be part of the discussion. This does not mean every home needs major remediation. It means the moisture conditions, visible mold, musty odors, prior leaks, humidity issues, HVAC conditions, and mold test results should be reviewed in context. One of the biggest mistakes is jumping directly from symptoms to expensive remediation without first understanding the building. Another mistake is ignoring clear building problems because the mold is not visible. Mold problems often start with moisture. That may include roof leaks, plumbing leaks, basement seepage, crawlspace moisture, condensation, HVAC issues, poor ventilation, or building materials that were wet and never properly dried. If mold testing has already been performed, the results should be interpreted carefully. A mold report can show what was detected in a sample, but it does not always explain the source, the severity, or whether the proposed next steps make sense. That is especially important for people who are health sensitive or already overwhelmed by conflicting advice. The right approach is practical. First, look for moisture sources. Second, review any mold testing in context. Third, determine whether cleaning, repairs, humidity control, additional investigation, or professional remediation is actually needed. And fourth, if remediation is proposed, review the scope before spending thousands of dollars. My Mold Expert provides independent mold guidance based on more than 20 years of field experience with mold reports, inspections, remediation reviews, and indoor environmental consulting. We are independently owned and operated. We do not perform remediation. We do not outsource your case to third-party contractors. And we are not a lead generation company. Our role is to help you understand the information in front of you, evaluate your options, and make a clear next step decision without sales pressure. If you are dealing with chronic health concerns and suspect your indoor environment may be part of the problem, My Mold Expert can help you review your mold report, evaluate a remediation proposal, or decide what questions to ask next. Visit mymoldexpert.com to learn more. When Lyme disease, co-infections, and mold concerns overlap, the goal is not fear. The goal is clarity. Find the moisture source, understand the evidence, and make a better decision about your indoor environment.